A lot of congratulations to Delhi Gynecologist Forums to take an active participation in this World Breastfeeding Week. And today I'm going to talk on optimizing support for breastfeeding, a global overview. Today, as Dr. Arun has just now said, we are having golden hour feed is at 40% in the last two National Family Health Survey. It has been sticking at 40%. And our aim is that it should become 100% use of this golden hour. This World Breastfeeding Week is a global healthcare event which is done during the same dates, promoting the importance of breastfeeding benefits to newborn and the mother. We all know that बच्चे के लिए माँ का दूध अमृत है, and 100 times each one of us have faced the sentence when somebody is trying to challenge somebody कि आपने माँ का दूध पिया है तो ये करके दिखाओ. So that is the thing, and I think I'm just going to say further on the same thing. Breastfeeding is a gold standard of infant feeding, and Sir has highlighted that 3 aims are there. Early initiation of breastfeeding within 1 hour of birth, and from 40% it should go to 100%, and the total good work lies on the gynecologist. They have to take this particular challenge, and the doctors and nurses should definitely see to it that who are delivering should definitely do this particular activity, and it should not remain at 40%, it should go to 100%. The second aim is exclusive breastfeeding for the first 6 months of life. And thirdly, introduction at the end of 6 months of the solid feed, and together with this, the continued breastfeeding up to 2 years of age or beyond. Now, ये lactogenesis क्या है? Lactogenesis is the onset of milk secretion and includes all the changes in the mammary epithelium necessary to go from undifferentiated mammary gland in the early pregnancy to full lactation in postpartum period. The stage 1 is when the gland becomes sufficiently differentiated to secrete small quantities of specific milk components such as casein, lactose, and a special fat in the milk. And this occurs in mid-pregnancy. And that's why there's a big myth in gynecologist's mind that a mother who gives birth to a preterm baby cannot feed, but that's not so. She has enough maturity to have feed for her own child, and this particular thing should be realized by both neonatologists as well as by gynecologists. The second stage is from a late pregnancy up to day 4 to 8 is the onset of copious milk secretion associated with parturition. And this is brought about by decrease in progesterone level drastically. Third is the whole process of milk secretion becomes an auto mode, and it is no more an endocrine control. There is a maintenance of milk secretion, and the mature milk production is established. This usually takes place at around day 10 and lasts until the weaning begins by the mother. And stage 4 is a full maturation of the alveolar cells. Now, this is the stage 3, where you can see that the progesterone, which is absolutely flooding the system in pregnancy, you find soon after birth, it drastically levels come down, while prolactin, you can see it is coming in the last trimester. It takes a peak at parturition, and soon after that, this 1 hour golden hour is that the prolactin is already there in the circulation, and this is the time to breastfeed the child. Is factory ka lock khulna hai, that is 1 hour feeding is only that. It is just unlocking that factory, and it takes an automatic control. Whether it's our country, Ministry of Health, or it is World Health Organization, or you take any country, the guidelines are more or less the same. The breastfeeding is the gold standard of infant feeding. Now, as far as the history of ours is concerned, history of breastfeeding, it has been universal that the humans have breastfed their newborns up to 3 to 4 years. And when the breast milk was not available for one reason or the other, there was a practice in the old time of a wet nurse, or what we used to call dhai. And the golden hour feeding concept was totally missing. In the last 75 years, I have not seen this thing. And I joined medical college in 64. There was no training of this particular kind. I came to know only in the last 15 years. But it was not so much emphasized, which I have been emphasized in the last 3-4 years, since the time I have started presenting this golden hour concept myself. Otherwise, it was missing, and this was left, at least our Indian continent is concerned, कि उसको शहद पिलाएंगे, कोई घर के पुरोहित आ जाएंगे, या कोई elder lady of the house is going to start feeding. So this concept of breastfeeding was missing in this first hour. And this was because of the poor knowledge, because during our undergraduate career, during the basic nursing training time, we never had even a single hour training on breastfeeding. And so much so, during our MD time, I did MD from PGI Chandigarh. There was A to Z what BPNI now claims to tell each and every doctor was also missing. And that is the reason why it is golden hour feeding has stuck to 40% and not making 100%. Unless it is ingrained in every gynecologist's mind that this 1 hour feeding is the thing which is required, and this is you and your nursing staff can do it. I'm sure this is there because of the poor knowledge. Decrease in the breastfeeding is a civilization problem, and I think we have to stop it. You can see here that there's a wide variation of the breastfeeding. Luckily, we are in the dark green area. India is a breastfeeding country. And in spite of that, you can definitely see there is a decline, and the quality of things which Dr. Arun wants it is not happening in the country. You can see here that in the word around golden hour feeding of first 1 hour is around 40%, and in the least developed countries, it is around 60%. As far as we are concerned, it is around 40%, and Sir has said that in the last almost 2 surveys, we have found that it is stuck at 40%, and we have to make it happen to 100%. And then only we can say that the good work is done by a gynecologist. And you can see here the global trend. I've just brought US and India together here. One can see that a golden hour feeding for India is 40%. And exclusive breastfeeding has definitely taken a jump from National Family Health Survey 4 to 5 by almost 10 points. And I think that makes, and now we stand around 65% exclusive breastfeeding. While in US, the golden hour feeding is 26%, exclusive breastfeeding for 3 months had been around 50%, and exclusive breastfeeding for 6 months had been around 25%. Now, what are we totally missing is lactation facility at our workplace. In US, it is around 50%. You find in Middle East countries also, in schools and all, there's some facilities are available. In India, it's totally lacking, hardly anywhere. And in US also, you can find that the formula feed is in the first 2 days introduction is around 20%. And I think as far as we are concerned, we should be also around the same. Now, you can see this particular slide where we have compared the 3 surveys of National Family Health Survey 3, 4, and 5. And you can see, as Dr. Arun pointed out, that in the last 4 and 5th survey, the golden hour feeding had been just 40%, and exclusive breastfeeding has jumped definitely from survey 4 to survey 5 to almost 65%. Here comes the importance of antenatal counseling. There has been a study done by CDC and the US FDA, which shows that when patient had a dedicated counseling during an antenatal period, that particular woman was motivated and she breastfed exclusively for almost 8 months. When this counseling was missing, this was less than half. So I am a very strong proponent that dedicated counseling session should be given during the antenatal period, where this lady is told about the importance of breastfeeding. The full examination is done, and she should be offered at that particular time classes also, that she knows about the different techniques, what all has to be done, what are the challenges are there in the breastfeeding. And I think, it is 80% of knowledge should be there with her, and the practical part she will definitely know once her mind knows what is the theory behind it. Now, this again, I reiterate that breastfeeding is a good obstetric practice. This should be ingrained in the mom's mind during dedicated antenatal counseling session. That is a complete nutrition for the child, and it makes your baby strong by giving protection against the child infections. It increases the intelligence and probable future reductions in non-communicable disease like obesity, diabetes, and stroke. And as for the mother is concerned, besides shaping her, it gives protection against breast cancer, against ovarian cancer. It improves the birth spacing also for her, and also decreases the chance of non-communicable diseases like diabetes, which has been the capital, our country is the capital for the same. Now, beside golden hour feeding, skin-to-skin contact also has to be ingrained in nurses and the doctor's mind, that this also does wonders. It's vital for the baby. It satisfies the need of the baby of comfort and the calming. It can boost the mother's milk supply in a big way. It increases the anti-fight and the flight response of the infant, the stress management, and it makes the person calm, strong, intelligent, and emotionally stable. This is skin-to-skin contact is vital for preterm neonates, where it is often can be offered as a kangaroo care. It had been pleasure for me to see the beautiful part has been done in Sharda Jain Hospital, which is a nodal hospital for training for kangaroo care. Now, what I've learned in the last 50 years since the time I've got my post-graduation, that the breastfeeding for the first 6 months is crucial. It has to be exclusive breastfeeding. Protects infants from the allergies, neonatal mortality and morbidity, and childhood illnesses. Mother should continue breastfeeding at work. Now, once this particular information goes to the mother, that expressed breast milk on the room temperature can be okay for 4 hours. If she keeps in a fridge at at 4 degrees centigrade, then it can be, this particular milk can be used for 24 hours. Even if the facilities are not available at the workplace about feeding, then I think, this particular knowledge will go a long way for her to exclusively breastfeed the child for 6 months. As far as the benefit to the mother, I've just now said, it definitely decreases the risk of breast and the ovarian cancer and type 2 diabetes and a postpartum depression also in a big way. And we all must know that the infant formula does not contain antibodies and found in the breast milk and should not be promoted at all. As for the baby is concerned, it gives the optimum physical growth, the metabolic competence, the emotional competence, the optimum cognitive development, and increases the IQ by almost 10 points. And it decreases many infections and modulates the inflammatory response of the baby, and decreases the mother and child bonding. As far as the HIV is concerned, we all know that antiviral drugs have done wonders, and the dictum is zero viral load means zero mother to child transfer. The solid feed should be started at 6 months and not earlier. Long-term benefits for children are definitely, I have already reiterated. So this is a simple slide which you can put it up in your labor rooms, or it can be part of the antenatal card of yours, that it improves the health and the development of child. It improves the health of the woman, and beside cognitive and learning educational attainment, because of the increased physical stamina, the productivity of individual increases, and thereby the wages and the economy of the country. It is just the same what I have said just 2-3 times. What is the good effect on the mother and in neonatal period, how it decreases the diarrheal incidence and incidence of pneumonia. This continues in childhood, and these babies are definitely bestowed with a higher IQ, and it prevents them from non-communicable diseases. So the time has come for obstetrician to play a critical role in supporting breastfeeding, and should not miss the counseling session in the antenatal period about the golden hour and the utility of 6 months. And they should be also told how it can be extended with solid foods up to 2 years. Now here I just wish to bring the myths which are there in our mind. The biggest myth in public, nurses, and a doctor's mind, including gynecologists, is that the formula feed is equal to breast milk. Big no. They are told to wash the breast nipples before breastfeeding. And we all know that the Montgomery tubercles are there, which have an anti-infective secretion and which prevents from the infections, and this should not be the practice. Another myth we have in our mind: whenever we are sick, we should stop breastfeeding, and that's not the case. It is usual that the people who are working people, they say that when breastfeeding is done, sore nipple or hurting nipples are inevitable. This again because we have poor knowledge how to know the real technique and how latching should be properly done to avoid all these problems, which are big challenges. You should separate a newborn and a mother to be allowed to have a rest. Again, everybody says that rooming in is the practice, and not only rooming in, आपको mother को और baby को साथ एक ही bed में रहना चाहिए, तो उससे definitely increases bonding. And again, working mother says that you can never start this thing if you breastfeed the child, the baby will not accept the other feeds when she's away. She will find it difficult. People say that no medication can be taken. We all know that majority of the medications have a very insignificant amount in the breastfeed, and I'm sure dedicated education in this particular way, we will know which drugs are harmful, and we can definitely advise and counsel them. Young girls definitely have in their mind that the breastfeeding causes sagging of the breast. It is absolutely opposite, and it is how they are empowered that right kind of a bra and what should be the position of a nipple should be there, that can avoid sagging of breast. People say that आप ज़्यादा breast feed करोगे तो आपके बच्चे जो हैं चिपकू हो जाएंगे. Breastfed babies are clingy. That's not true. It is hard to wean a baby if you are breastfed or more than 1 year. So these are a couple of things are there which are myth in the mind, and I think this have to be told in a long sessions, and every time after the counseling session, anytime she has a queries, you should definitely answer queries one by one. So the challenges are lack of knowledge and the skill of not only of the mother, because there has been no training during the school time and the college curriculum as far as the breastfeeding part is concerned. And I just now told you what is the handicap of training for nurses and RMBBS doctors in breastfeeding. And I think there should be dedicated 7 days course on breastfeeding, not only to the nurses, but as to the MBBS doctors as well. Nipple pain and a breast pain is definitely seen by good 30% of patients, and this is it is not so significant, and if the patient is counseled well, that the benefits are much more than this particular pain. I think things can be sorted out. Too little milk or too much of milk again causes problem, because if there is too little milk, there is a lot of anxiety on her, and whenever there's an anxious mind, you can find that the success can be defended. You have to everything. If there is a problem, the solution can definitely be right there, and that comes from the right kind of a training to the nurses as well as to the doctors. Depression, I find quite a few working ladies do find, and otherwise also, कि दूध पिलाते ही इतना समय लग जाता है. Is it going to be life like this feeding the child? So quite a few people that get into depression, and again the counseling does wonders. And we also have one lacuna, is that no support lactational services are available on breastfeeding once she is discharged from the hospital, both at home or at workplace. So obstetrician nurses who are not have had adequate training in breastfeeding support and management leads to their lack of confidence and competence in providing effective support to breastfeeding mothers. So we also know that the lack of support for breastfeeding is at workplaces there, and let's put our hands together. Let's make breastfeeding work, and optimal maternity leave and workplace accommodation support and environment to enable breastfeeding. So she should have a freedom that she can breastfeed anywhere, anytime. So our aim should be 100% feeding And once this particular aim is put in our mind, the rest of things can be sorted out. Now, the challenges are the cesarean section rate is rising, and we definitely know it 4 times less chance of having a feed in the golden hour, unless, the gynecologists make their commitment to themselves that I am definitely going to take a help of the neonatologist and the neonatology nurse to help, and make anesthetist also a part of it. And I think, this particular problem can be sorted out. I can see many hospitals in the city have started doing it in the private sector, and I'm sure it should be made 100%. Again, I just now told you that biggest myth in our mind is formula feed is equal to breastfeed. So lack of support from the family and the community is also seen because of the nuclear families are happening these days. Even if the elders come, the younger people don't want to take any advice from them. Maternity leave policies definitely impacts the breastfeeding because returning to work too soon after delivery can make it difficult to continue breastfeeding. And I think, the proper knowledge about the express breast milk can definitely sort out these problems. And I did mention to you that, our breastfeeding support after the discharge from the hospital is totally lacking in this country. And we need to have on-job training for health professionals and ASHA workers to achieve breastfeeding goals, which myself and Dr. Arun have just pointed out. We all know that WHO, our Ministry of Health, have highlighted the same guidelines. Every country has almost similar guidelines. And we definitely appreciate the work of VPNI for training. And this baby-friendly hospitals, this is the time, sir, that, the most of the government hospitals can be also approached. Now with the luxury things there around, the people are receptive. Everybody is receptive in a government and public sector, private sector hospitals. As far as we also know that if breastfeeding is done, we definitely save a lot of money for the family, and it is billions and billions of dollars for people abroad, and for us it is rupees that we save, and it improves the health of the mother and the child. So this is the financial aspect of breastfeeding. And coming to the last 10 steps for successful breastfeeding are that have a written breastfeeding policy that is routinely communicated to all healthcare staff working in a hospital, small or big. Train all healthcare professionals in the skill necessary to implement this policy. Inform all pregnant women about the benefits and the management of breastfeeding. Help mothers to initiate breastfeeding with this golden hour of birth, and show mothers how to breastfeed and how to maintain lactation, even if they are separated from their infants for some time. And give infants no food or drink other than breast milk unless medically indicated. Practice rooming in and allow mothers and infants to be together 24 hours a day. Encourage breastfeeding on demand. Give no pacifiers, artificial nipples to the breastfeeding infants, and foster the establishment of breastfeeding support groups and refer mothers to them to discharge from these hospitals. We have to work hard on it, and I'm sure with everybody putting their hands together, this particular part can be done. So finally, coming to the training part of it, I think, each gynecologist need to get trained, and I will get back to you on this particular aspect. So thank you very much.